Rescheduling at an extra charge? No, we don't reschedule people at an extra charge. Life happens. We like that to be all inclusive. Now, if it becomes a chronic problem, somebody's rescheduling 3, 4, 5 times, then usually we'll just pause their subscription and tell them, hey, next time you come in, we'll have you pay. Otherwise, we don't want you as a patient anymore. We take our patients very seriously. So I received these questions via email from a talk I gave on stage. If you guys ever have any questions or something that you want me to answer in the Q&As, please email questions@dralexspinoso.com. I'd be more than happy to create a video, load it up into these Q&A videos so that everybody can benefit. So questions@dralexspinoso.com. So let's get into it. Number one, how do you handle pellets? We handle hormone therapy pellets in 2 different ways. One could be month-to-month payments, or the other could be all-in-one treatment. You pay the price at the beginning. So with a subscription model, for example, we would charge a patient for 2 sets of pellets up front. So if it's a female, the price of pellets range from $350 to $550, and it just depends on geographic location, what everybody else around us is kind of charging for that. Males, anywhere from $800 to $1,100, $1,200 if they get a dosing above 2,000 milligrams. And again, that pricing is ranged based off the geographic area, not necessarily what they're getting. The pellets include, obviously, the pellets, the trocar, the insertion, the follow-up, as well as 1 lab every quarter. And that lab is usually a basic lab that checks their hormone levels, their CBC, their CMP, their cholesterol levels. In males, the PSA. And in females, obviously, your estradiol, progesterone, testosterone. With a subscription model, we do that year up front, or we do month to month, anywhere from $169 a month to $250 a month, depending on what they're getting. And when it depends on that, what I mean by that is that they can get the pellets alone, or if they're going to get pellets with, let's say, an anastrozole estrogen blocker, that's going to be an extra $25 to $50 a month. If they're going to get that plus HCG, then, or Clomid, that's going to be an extra $100 a month. So that's how we do this subscription model. Do we put a pellet initially when a patient hasn't paid in full yet? Absolutely. We make sure the first payment, however, covers all of our costs. So the first payment, if you're going to do a subscription model, or if you want to get a down payment or something like that, we always trust the patient to do good. And most people say, well, I don't trust people. I get it. But look, most of the time, hormone therapy, weight loss, aesthetics, these patients know they need to come back for treatments or know that this is not a cure. So they're going to need to go somewhere, whether that's you or somebody else, it's fine. But really, most of these patients want to do good. And as a result of that, we will treat a patient when they haven't, quote, paid in full for treatment, as long as the first treatment or first payment covers the cost of goods. So for example, if we're doing the month to month, $169 should definitely cover all your cost of the pellets, the cost of the trocar, the cost of your nurse practitioner, and the cost of marketing, which usually does. So we're about break even month 1 if we do that at the baseline. If they do Clomid or HCG on top of that, or even anastrozole blockers by month 2 when they get their follow-up lab 6 weeks later, we're already ahead when it comes to that. So yeah, we trust patients to do right by us, and most of the time patients are pretty good about it. So question number 2, with a brick and mortar, if you're doing hormone therapy, replacement, and weight loss practice, how do you communicate the new subscription model with the existing patients? So a couple different ways. Number 1, just be as open and honest as possible. Do an email blast to all the existing patients that you have already signed up. None of the patients that didn't sign up or the leads that didn't sign up, because it doesn't going to benefit them. Just tell them, hey, we are moving to a subscription model. This is why it's going to benefit you. It's going to increase our level of care. It's going to make sure that you're getting your medications. It's going to make sure that you are well taken care of and we don't have to chase you down. So emailing and text messaging about that. Putting an announcement, hey, in 60 days, in 45 days, in 30 days, we're going to be moving to this model and this way of billing. Let us know if you have any questions before then. That gives them ample time to answer questions, gives them ample time to respond, gives them ample time to move over to the subscription model before that time as well. Maybe you give a little bit of discount on the subscription model for the first 100 people that sign up and move their billing over to subscription, whatever you need to do. But communicating that via email, text message, phone calls, then when they're following up that month or the next 2 months, that's why we do it over like a 2 month or a 3 month time span, that announcement, because usually you'll see every single one of your hormone patients at least once during that 3 month time span, especially if you're doing testosterone or something like that. That gives you time to communicate clearly the expectations of the program, what the subscription model looks like, and that way they are really prepared going forward into that model. With that, how are no-shows handled in a subscription model? Do you send the meds? Do you reschedule at an extra charge? And what's the policy on no-shows? The way no-shows are handled is we have a contract that says if you're in recurring or subscription model, you have to be in it for at least 2 months. Some clinics will put 4 months, 6 months, a year, whatever works for you. They have to email or call and confirm that they do not want to continue with the subscription model. And then with that email, no matter what, if they call, they have to email with their name signature and everything on it, showing that they want to cancel. This provides documentation and irrefutable proof that they want to cancel that goes into their chart. No-shows are actually talked about in the contract. If they don't show for their appointment, it's on them. The subscription keeps going no matter what. They have to cancel. So in the future, if you have patients that forget about it for 6 months and then all of a sudden they want a refund, no. They had it in the contract. They're adults. It was up to them. Now you can give them a credit if you want to extend them a credit. Sometimes we'll extend a credit for a few months towards their next treatment, etc. However, we do not like to refund. Now, if a patient goes crazy about it, hey, cool. For services not rendered, you can refund them. However, they signed a contractual agreement, and make sure that you're explaining that clearly on the contract, that the steps that they have to take in order to cancel their subscription model with you. Do I just send the meds? Usually, if it's non-controlled and it's something that they're going to need and we know they're going to need, yeah, you can absolutely send the meds if they were originally cleared for that med by a medical provider. If they weren't, if they were only treated or cleared for 30 days or 60 days or 90 days, and that 90 days is up, then the medical provider would have to see them again or assess them again, even via telehealth, to ensure that they're continuing their treatment. So they need to be contacted before their build and their next medication or their refill is sent out. So when it comes to controlled substances, we like to see a patient or review their chart every 90 days because 90 days is really what the DEA wants in terms of refills and follow-ups. Non-controlled, we'll do a full year and continue to send the meds as long as the provider has written that for a full year, they're allowed to be on the medication. If there's any changing in dosing or anything like that, again, that goes through the provider. You can't be practicing medicine as a clinic director or an MA, non-medical, changing people's dosing. That's not legal. Your provider has to approve those changes and those treatments. Rescheduling at an extra charge? No, we don't reschedule people at an extra charge. Life happens. We like that to be all inclusive. Now, if it becomes a chronic problem, somebody's rescheduling 3, 4, 5 times, then usually we'll just pause their subscription and tell them, hey, next time you come in, we'll have you pay. Otherwise, we don't want you as a patient anymore. We take our patients very seriously. Again, that's very, very rare. And again, the policy on no-shows, I just talked about it. If you no-show, hey, we're used to it. That's part of doing business. We just make sure that we overschedule maybe on those days or those times that we know people like to no-show. That's how we handle the subscription model in hormone therapy and weight loss. I hope that answers your questions on that. Any other questions, please email questions@dralexspinoso.com.